Hi there, everyone. Thank you all for joining, and thank you for those of you who will be watching later. But my name is Ethan, and I am a board certified physician assistant, and I'm a provider here at TrueBody in Cody, Wyoming. I've in uh, been in primary care for the last 3 years, but now primarily focusing and specializing in functional and integrative medicine. Today's talk will be about new programs and new protocols that we're excited to be rolling out here in the near future. And the goal that we have with these programs is all about giving our patients a more comprehensive approach to their health goals. And we'll have several different programs that we will talk about, but all of these are going to be designed to provide a framework to really optimize their health in a more proactive approach. So I just wanted to talk briefly, kind of about us real quick, and our primary focus in what we're doing here is on personalized and root cause medicine, and we do everything from medical weight loss, gut health, hormone replacement, optimization. Also have a lot of patients that are coming to us for genetic testing and as well as skincare. But our primary goal is personalized and root cause medicine. So just a little bit about these, kind of why we're doing this, I guess, what it is, why we're doing it, this TrueBody method. And basically what it is will be uh, protocols that are designed for specific health goals, again, like hormones or performance, metabolic health. And we're already doing a lot of these things individually, but what we're going to be working on is connecting them rather than having a patient come in and pick from a list of supplements or treatments, or different tests. We're working on creating a more structured pathway. We get a lot of patients that come in and maybe they're already doing hormones or weight loss, but they're wondering, like, what else can I be doing? And that's why we're designing these. This should make it easier for our patients, a lot less confusion or misinformation, but also providing just a more comprehensive and measurable approach. And mostly about helping patients get the most out of their time and effort as well. So just a brief overview. We're going to dive into these kind of one by one, but looking at everything from hormones, metabolic health, gut, inflammation. So all of these programs will have kind of a primary goal behind them, but just kind of giving you an idea of where we're headed, some of the different programs that we will be talking about. But the first one we're going to be talking about is our True Strength and Hormone program. This is going to be for everybody who feels like they have a hormone imbalance or low testosterone or dealing with symptoms of fatigue, low libido, poor recovery, losing muscle. And this can be beneficial for patients already on hormones as well as new patients that would like to go down the hormone optimization route. But again, the core focus will be hormones, building, maintaining muscle, performance, which can be physical, mental, or both. And that performance will look different for everybody, or their performance goal, I guess, will look different for everybody. But we want to get the most, we want to help patients get the most out of their treatment and help them get closer to their health goals. So what will be included in this program will be a very comprehensive hormone panel, typically a lot more detailed than patients have been getting previously at outside clinics. We are pretty consistent at taking a deep dive into a patient's hormone labs, and patients are often surprised when they come to us just how much we are checking. Other things that will be included will be hormones, and this can be pellets, injections, depending on the person, depending on their goals and what we need to be doing, as well as targeted peptides for a variety of different goals, targeted supplementation. We're also a really big fan of our body composition scale, which is that in-body. Being able to monitor progress over time through that is a big part of what we do here at TrueBody. So this is our kind of our hormone program that we'll be introducing. The next one is what we call our True Metabolic program, and this is more so kind of the weight loss side of things. Patients who might be a good candidate for a GLP-1 or dealing with inflammation, dealing with elevated blood sugar, resistant to insulin. This is primarily what this program will be for. And the core focus here will be fat loss, metabolic repair, really trying to work on that insulin sensitivity and reversing that to prevent diabetes and all the long-term effects of that. So what's included with this program, if somebody is a good candidate, will be a GLP-1. And we're starting to push a lot more patients toward tirzepatide over semaglutide. I have patients that they just seem to feel better, way less side effects, and getting the results that we need quicker and without any side effects. We're really trying to minimize those. But that is primarily what we're utilizing with this program, as well as any targeted peptides that they might be a candidate for, really focusing on making sure the nutrition is dialed in, especially high protein. Again, the in-body tracking is a very big part of what we do. Labs looking more so along the metabolic panel, A1C, insulin, taking a deep dive into those. Supplements are also very important, as well as select IVs, IV treatments that support liver health and fat loss and boosting energy. The next one is shifting gears a little bit and looking more so at the overall gut health. So the True Gut RX is primarily for patients dealing with everything from symptoms like bloating or IBS, inflammation. And gut health is just very, very important. Strong connection between gut health and energy, hormones, immune system, as well as overall skin health and appearance. So definitely a broad list of patients that this could be for, just again, because the gut health has many different, basically our gut health is not just limited to our gut. It has a connection with many other areas around the body. So primarily getting to the root cause of symptoms, managing inflammation, and supporting that gut microbiome is the primary core focus with this program, as well as anybody with, primarily, gut health symptoms or history of autoimmune disease. So included with this is a lot of different tests and different workups, depending on the symptoms, depending on the goals. But a GI map, food sensitivity testing, we utilize these a lot. They're looking at different things with the gut, but providing very useful information that we can then use to kind of find out, get to the root cause of what's going on, but then be able to utilize targeted treatments or supplements or peptides, whatever it may be, to help repair the gut lining, help with gut inflammation. We're also just doing basic labs, micronutrient labs, just a lot of different ways that we can look at somebody's overall gut health. And we utilize a lot of different supplements with gut health, and we're working on getting more supplements in-house in our clinic. And these are supplements that we use and trust. That way our patients can get the results that we're looking for. Going back to the repairing the gut lining, this is a term you might hear a lot called leaky gut. And when that happens, that can then just lead to a lot of downstream chronic inflammation and many effects that we just want to avoid and repair if it is going on. Another program that we're rolling out is more for energy really designed or designed for patients who are dealing with burnout, chronic fatigue, kind of more so getting to the mitochondrial health is what we're looking for here. And these are people who are still fatigued, despite, hormones are looking good, hormones are optimized. It's like, what else are we missing? And this is different from the metabolic program that we talked about earlier. This is more so looking at cellular health and energy and mitochondrial support. So very, very useful program as well for a lot of our patients. So what's included with this will be labs, a lot of labs that we're doing already, but looking at kind of in more detail, taking a deep dive into thyroid, into iron, B12, cortisol, and not only cortisol at the time of the lab, but checking cortisol throughout the day to really see, is it high when it should be, is it low when it should be, or what's going on there. But another thing that will be included that we're excited about is what's called a me screen, and this is looking at basically how well our body is working, how efficient our mitochondria is working. Mitochondria is important for so many different pathways around the body, I guess. And if it's not working the way it should be, the list of symptoms or issues that are going on are very, very long. So we're definitely looking at that. But then we can utilize a couple things like NAD, methylene blue. Methylene blue we use this a lot, and it can really just help with both physical and mental, or improving both physical and mental fatigue. But we can also use a lot of things like targeted peptides, targeted supplements, depending on labs and different tests and symptoms that are going on, but also really making sure that we're supporting that thyroid. So a long list of things that are included with this program here, but very, very important for a lot of our patients. So just a brief overview here. The next one's more for skincare, and I'm definitely not the skincare expert here, but Emily, Emma, Megan will be able to definitely provide a lot more information about this program. Can be useful for a lot of our patients of all different ages, but the core goal and focus will be, regeneration, not just a quick cosmetic fix. So that's the primary goal with this one here. So a lot of different things that come with this one. And again, Megan, Emily, Emma, they'll be able to really personalize this for you, but including everything from microneedling and our skincare program to more regeneration treatments. So definitely excited about this program, but some more information about this one will be coming in the near future here. The next one we're talking about is more of like a detox treatment. And this can be for anybody who is either dealing with chronic illness or recovery from illness or surgery, travel, anything really just to kind of speed up that recovery pathway. What will be included with this? A long list of different things, but on top of our comprehensive labs that we're already doing for a lot of our programs, we're adding specialty labs to it, looking at inflammation, oxidative stress. How is our detox pathway working? So we can definitely get pretty specific with some of the labs, depending on the symptoms that we might be having. But we're also really excited about ozone therapy, and we need to do a whole separate discussion on ozone. But we're definitely excited about this. But what it is, it's involves medical grade ozone, and we administer this to the body with the goal of promoting increased antioxidation, supporting circulation, and really helping reduce inflammation. So we're excited about that, but a lot more information in the near future about that. We have a variety of different IVs we can do, like glutathione, vitamin C, NAD, supplements as well. These are all different. The IVs and supplements are different, but they all have the main goal of supporting antioxidant and anti-inflammatory pathways. And then we can also use targeted peptides for gut health and immune support as well. So we're excited about that one as well. So a little bit different, switching gears here, more so for screening and preventing chronic disease. And this program is all about that, all about cardiac screening. This is really for anyone who wants more information than just hearing about their good or bad cholesterol. That's basic. We can get that anywhere, and it's not even giving us the whole story. But this program is really designed for maybe patients with a strong family or personal cardiac history, or anybody who's looking at wanting a more in-depth analysis of their overall cardiac health now, but maybe a snapshot into their risk down the road. So really getting into the root cause of cardiac disease, and then being able to use targeted treatment and prevention of cardiac disease. So with this program, again, we're looking at basic labs, but primarily focusing on a more comprehensive cardiac and inflammatory panel. So beyond a standard lipid panel, which is just giving us, LDL cholesterol, HDL cholesterol, we're taking that a step further, looking at particle size, looking at LDL size, looking at the proteins that are carrying the cholesterol, because that tells us kind of the other big driver behind cardiac disease. And we can also look at inflammatory markers like CRP, homocysteine, like all important ways. They're all different labs that give us a picture of inflammation in our body. And we utilize lipoprotein little a lot as well. And this has given us a genetic marker that can be correlated with cardiac disease down the road. So definitely a broad combination of both a broad lab panel plus that really in-depth, those really in-depth labs that tell us what is going on inside the cardiac vessels, inside the walls of the arteries, that are kind of the true driver behind plaque buildup. So in addition to labs, we're utilizing what's called a Clearly scan, which is a software that maps our coronary arteries in 3D and gives us a comprehensive report on our overall plaque burden. It's a non-invasive test and a lot different than a cardiac catheterization where you have to get put under and much more invasive. So we like using that scan a lot. It gives us a lot of important information there. But then primarily, depending on our labs and our scans, we can utilize many different supplements and treatments based on those results, based on our goals. And these are very personalized for that patient. So again, the goal of this program is all about screening, and we can then monitor progress over time. So another one that we're excited about is what we call our true assessment. This is all about establishing a baseline, looking at risk and looking at underlying health issues. This information will then help us get very specific with what supplements or what treatments we need to consider. And we utilize genetic testing a lot, but that's all about, again, getting that baseline, looking at both our risk now and in the future. But also included with this program would be a sleep study order. Very important to look at this. Sleep is an important aspect of our health for so many different reasons, mental and physical health. We also look at biological age, and we use this as a contrast to your actual age. And this tells us kind of how well our cellular health is functioning. We also utilize what's called a gallery screening, and this is basically a screening test that can tell us about potential cancers long before we might see them on a normal blood test or before we might get symptoms. So we can utilize that as well. And then other things that we've already talked about, me screen, in body, grip strength, we utilize that a lot. So again, this is all about getting a baseline. Some of the things on the list we can do once. Others are meant to be tracked over time, and tracking and monitoring is how we know if the treatments we are doing are actually working. The last program we have is what we call our True Regeneration program. This is all about supporting long-term joint healing, regeneration, and basically focusing on the regeneration part of it and not just reducing inflammation or providing a Band-Aid like we might get with a steroid injection. So included with this would be targeted peptides that, again, support joint health and repair, but we can get into different biological joint injections and PRP injections, ozone treatment, we've already talked about that, specific IV therapies depending on the patient, depending on what's going on, as well as methylene blue, NAD, and some other therapies that we've already talked about. So definitely excited about that one. For those patients of ours that are just dealing with kind of long-term chronic joint issues, and we're providing an option beyond a Band-Aid treatment. So we're excited about that. So today's presentation was really just a preview, not a finished product. We are still working on a lot of the kind of the final details like pricing and logistics and pharmacy availability, sourcing, partnerships. There's a lot of things that we're still working on. So we're taking our time with rolling it out. We want to make sure that everything is organized and in place before we officially make these available. I also want to emphasize that my goal today, again, was just kind of educating what we're working on and having kind of informing our patients of what will be coming in the near future. There's a lot more work that needs to be done on our end, but we'll definitely keep you updated. There are more announcements that will be coming in the near future as we get ready to finalize everything and as we get ready to launch. But real quick, I just want to talk about what the process looks like here at TrueBody. For those of you who are currently patients, you'll kind of understand what we do here. But for those of you that are new, this is typically what we do. We have a patient book, an initial appointment with a provider. We talk about symptoms and goals and health history and everything. Depending on that discussion, we will order labs and tests and screenings and kind of whatever the patient might be a good candidate for. We'll then sit back down, talk about the labs, and then build a custom treatment plan and determine a follow-up schedule at that appointment. And we have a patient portal, so a patient can use that at any time for questions, updates, refills, anything at all. So we spend a lot of time with you in the room at our appointments, but that portal is how we do a lot of our communication as well. So it's a great tool that we use a lot. And I just want to kind of mention our philosophy at TrueBody. One of our main pillars here, I guess, is that we test, we measure, we monitor symptoms, labs, weight, what's working, what's not working, and there's really no one size fits all. Everybody's labs and health goals and lifestyle and budget are different. So this is where we really have to make it personalized for the patient. So yes, we're making these programs, and these programs kind of have a checklist, but the little nuances and the targeted treatments within the programs, these will be different for everybody. So it's definitely not a one size fits all. And we're really primarily focused on long-term outcomes, not just a short-term fix or a short-term Band-Aid. So if anybody has any questions at all, I invite you to ask those. Otherwise, we will give it a few seconds here, and then we'll sign off. Oh, I appreciate that. Thank you for the compliment. And if there's a question you think of after we sign off, or later in the day, feel free to message myself or Betsy or one of my nurses, or give us a call. But like I said, we have a lot of things that we're still working on in the background, kind of finalizing all the details, but we're excited about it. Okay. I'm going to sign off. But again, thank you all for joining. Thank you for those of you who will be watching this recording later. And thank you to our patients who are currently our patients. And if you're not, I look forward to meeting you soon. So thank you, everyone.